What's up, beautiful people? Another day, another study. We've talked about before, I think most of the talk about toxins on social media is complete garbage. However, there is one that I've talked about before, and it's links to cardiovascular disease and dementia, and that is PM2.5, a type of air pollution that encompasses different molecules. We know that urban areas are particularly prone to this due to industrial waste and vehicle emissions. And preclinical studies show that PM2.5 may influence autism spectrum disorder risk through things like epigenetic modifications, inflammation, changes in the gut microbiota, and oxidative stress, which can lead to structural and functional changes in developing brains. And this was a retrospective study examining the association between prenatal and early life exposure to PM2.5, especially sulfate and ammonium and ozone, and then autism spectrum disorder diagnosis. So the cohort included over 2.1 million live births. This was in Canada. About 8% of those children were diagnosed with autism spectrum disorder before the age of 5. 3.5 times more boys were diagnosed than girls, which we see in the literature, more boys are diagnosed than girls. Children with ASD were more likely to be born to mothers with underlying health conditions, which we've also seen in the literature, things like asthma, diabetes, and hypertension, as well as lower socioeconomic status. So overall, prenatal exposure to PM2.5 was associated with a 15% increased risk of ASD per 3.5 microgram per meter squared increase. When they adjusted for ammonium and sulfate as by itself, there was no significant association, which means it seems that ammonium and sulfate were driving the majority of the risk in the total class of PM2.5 pollutants. In general, the effect size was larger during the second and third trimester and in urban compared to rural areas. And then ozone exposure, another environmental pollutant, in the early life, in the first year of life, was associated with 9% increased risk of autism spectrum disorder. And when they did the concentration analysis, risk was low at low concentrations, and then around 5 is when you started to see a minimum, and then it rose sharply above 10. So overall, this adds to the growing body of evidence that air pollution is a growing concern. The WHO recommends that we keep the yearly average less than 5 and the daily less than 15. If you're in an area that has above those on a regular basis, I would consider looking into air purification systems for your home or work or wherever you spend the most time.